was difficult for me because to apply for health insurance, either you have to pay for it at your job or you would have to get Medicaid, and I wasn't eligible for that.
It's kind of terrifying knowing that at any moment you could have an injury or become ill, and a trip to the emergency room is not something that everybody has a savings account waiting to pay for.
I had 7 or 8 years of no coverage. One of the biggest things that I worried about was winding up in the hospital and getting buried with a hospital bill and losing my house. I mean, and it would just, financially and mentally, it would be devastating.
I need the insurance. I had a problem before because I couldn't afford medication. For many years, I was afraid of going to the doctors and finding out what's going on, because then I'm going to have nowhere to take care of it.
Trinity Health envisioned a nation with an affordable healthcare system that left no one behind. In direct alignment with our mission and values, our insurance coverage expansion advocacy, outreach, education, and enrollment efforts have been embraced by our regional health ministries in communities across the country. Our ministry's coverage expansion story is important and worthy of sharing. Collectively, we assisted nearly 300,000 individuals the first year health insurance exchanges were operational. To our Trinity Health colleagues in communities nationwide, it was clear that our focus on coverage expansion would have a vital and lasting impact on those who are poor and vulnerable.
I can't imagine anything more important than getting out and getting people into coverage. People without coverage have higher risk of health disparities. They take longer to get into a doctor. We get them at a later cycle in terms of disease. It's so important. It's one of the most exciting and important things that we can do to get them into coverage.
Holy Cross Health is a strong supporter of the Affordable Care Act because we believe that access to health insurance greatly enhances access to high-quality healthcare services.
To date, Mercy Care has enrolled over 1,500 individuals in a qualified health plan or Medicaid through the health insurance marketplace. We have assisted over 8,000 individuals with understanding their insurance options.
We immediately found the community's desire for access to health care exceeded expectations.
What do we want? When do we want it?
There was a very, very high demand on the part of the public as healthcare.gov started getting better and the information started clearer and consumers had a little bit of a healthier view on the proceedings. The numbers started picking up.
I helped 10 people to enroll, and I asked them, "Would you guys like to get an affordable insurance?" And most of them say yes.
Advocacy is an important part of our coverage expansion journey. We partnered with organizations both inside and outside of government to develop policies that expand access to health insurance. This work included numerous meetings between hospital leaders and state and federal policymakers. We know that continuing coverage expansion is important to ensuring the benefits of ongoing access, improved health, and that people-centered care is felt across the country. Education was one of the first steps in spreading the message of coverage expansion.
Kelly's here today to talk to us about health insurance, more specifically the healthcare exchange.
We took a retail mentality to try and get the word out. Our first location in our hospital lobby, the vision that the team came up with was a fusion of a Starbucks, Apple store. Taking a retail mentality was the first lesson learned for us and really brought people in the door.
Leaving the four walls of our hospitals proved key to bringing healthcare access to people in our communities.
A lot of people that we see in outreach do not have insurance. They don't have Medicaid. That's gotten better with the Medicaid expansion, but many people aren't aware that they're eligible. And we steer them in the right direction and tell them, even if they weren't eligible a couple years ago, that they probably are now.
So I lived without health insurance for about 15 years. I was in a homeless camp, and basically DOCO came into my camp, and I had a blood pressure of 210/140, and then if it wasn't for Mount Carmel, I'd be dead now. They helped me get to some primary care doctor, so basically they've helped me a lot.
It was probably easier to reach you when I was in the shelter, but when I went to the tent in the field, it's not so easy to be found.
But we came to the tent too.
Sure did.
We found his tent.
Sure did.
Yeah.
We discovered that our outreach was often the only connection to this important lifeline.
So I'm super grateful. I'm super grateful for the program. I'm super grateful for you as the woman you are. I know that like where I am today, I don't know if it would have been possible without those little baby steps, you know. More, like I said, more important than the simple health care provided by having insurance was like I learned how to be responsible. I learned how to be patient. I learned how to take some direction so that I could, you know, get out of that sense of apathy that you know, being in the streets was going to be where I spent the rest of my life.
Shoni, I told you in the office that to me you are an angel, because without her I had no hope.
Well, the people in the enrollment center were really friendly, you know, and if I had any questions, they would go ahead and answer them, you know. So it was really comfortable to be there.
She made sure that I got my medications because I was having a problem getting them. She opened that door, and she opened the door for transportation, and her and this program changed my life.
We learned that there was no simple path. The lack of affordable health insurance affected people of all ages and social economic status.
Young people like Kenta normally don't think that they're going to end up like this because they're young, healthy, and brave. But you know, when you think of the risk, it just is not worth the risk. I mean, he really could have been wiped out financially, and it's still going to be a challenge for us. But it makes all the difference in the world having the kind of coverage to take care of the things that he needs to have taken care of.
I need that insurance. I've worked all my life too, and I need it at this particular moment until something better comes along. There's so much negativity, and I see nothing negative about it.
To me, it's real good opportunity for a lot of people. A lot of people that don't have insurance like me. And I'm very happy, and I recommend that people get insurance.
No preocupaciones, no tiene mortificaciones en aspecto de su salud. No, none referring to her health.
It kind of gives me a peace of mind that if something does happen, if I do become ill, then I'll be able to get treatment.
I was in awe because I had much better insurance than I ever had.
It's working the way it's supposed to work. You know, you had a plan in 2014, you want to re-enroll in the same plan or choose another one. It's such an easy process to do it.
That worry that I used to have about, wow, I have to get medication. Wow, I wonder how much the doctor's going to charge me. You don't know the alivio, we call it in Spanish. You don't know the feeling that it takes away, the stress. I don't have to go through that. My life is just starting at 51.
We are humbled by the work that has been accomplished by leaders and colleagues across our system. As our core values state, we honor the sacredness and dignity of every person, and we stand with and serve those who are poor, especially those who are most vulnerable, improving the health of our communities one life at a time. This is why we continue to invest in outreach and educational activities and advocate for coverage expansion and in delivering people-centered care. Our commitment continues until no one is left behind.